Ladies and gentlemen, welcome to all the participants, and then welcome to the audience who are joining through Zoom.
どうぞよろしくお願いいたします。さまざまな栄養の取り組みの中で、ライフステージの最初の時期である母子の栄養というのは極めて重要であることは間違いございません。
It is no doubt that maternal and child health is very important amongst the various initiatives to promote health. Today in this session, we would like to look back at the history of Japan and the current status and, regarding the maternal and child health, and we would like to share a certain number of challenges and issues with all of you. So that's the concept and the purpose of this session. We have 5 permanent speakers today. Professor Iwamoto and Professor MIZUMOTO, they have been involved in this area, and they are going to share with us an overview of the strengthening and the improvement of the maternal and child health in Japan. And then Professor MORISAKI and Professor MURAYAMA are going to talk about the initiatives to tackle the low weight birth, as well as the assistance and the support in terms of nutrition for children during the disasters, in order not to leave anyone behind. And then that last topic of children's nutrition in the disaster settings will be discussed by Professor SUDO. And then we are going to have a full discussion with all the panelists after that. I would like to introduce the first speaker.
So this is Dr. Iwamoto Azusa from National Center for Global Health and Medicine. This is Iwamoto speaking. Thank you for your introduction. So regarding the initiatives in Japan for maternal and child health, I and Professor MIZUMOTO will talk about these 4 points as shown on this agenda. First, I will cover nutrition issues in the field of maternal and child health. In September of 2015, at the General Assembly of the UN, the Sustainable Development Goals, SDGs, were adopted. As you very well know, there are 17 goals. And Goal 2 and Goal 3 are related to nutrition, food, and health. However, this is very much related to all 17 goals. For instance, Goal 4, education, Goal 5, gender equality, Goal 13, climate change. These are often talked about lately, and this concerns everyone. And that is also expected of nutrition measures. There are various initiatives that are undertaken around the world, but in many countries, there are still issues and challenges that need to be tackled in many countries. The stunting for children under age and anemia in adult women, these are challenges associated with malnutrition, and there's the overnutrition such as obesity, and then there are a double burden or a triple burden of these issues affecting the low and medium level income countries. Up until last year, from 2015, I was in Cambodia conducting nutrition-related research. From Phnom Penh, it's about 200 kilometers. It's along the Mekong River. It's a rural village targeting women. I conducted some research on the factors behind malnutrition. Nyam is the name of this nutrition research project, but in the local language, Khmer, it means to eat. So in this Nyam research, in 12 villages, all the babies that are born in these villages were registered, and I interviewed the household situation. And then thereafter, once every 3 months, I visited these homes and measured the height and weight. And at the same time, depending on the number of months, the diet situation and disease episodes were interviewed. As a result, malnutrition was increasing month after month, and also with the threshold of 6 months where they will start to have baby food, the malnutrition level went up. Also, the nursing bottles were used without soap. They tended to have malnutrition. This is a result of horizontal survey. In addition to that, this is in a rural village in Cambodia, but even in rural areas, there are rubber plants and cigarette plants. So the parents would go and work. So the grandmother wouldn't necessarily have appropriate knowledge and end up feeding a lot of snack, and from early on, they would develop wrinkles. So the situation is very complicated, I thought. Now looking to Japan, the initiatives taken so far resulted in good outcomes. What's shown on the left is WHO Global Nutrition Targets. And what's shown in gray, the values for Japan are all low against the global targets. So the evaluation is very high. In particular, those that are under 5, the overweight children is shown here. And with the level of economic development, the percentage of overweight children is very low. The factors behind this can be varied. One of them can be that rice is used as staple food, and meat, fish, and vegetables, seaweed, beans are eaten as side dishes with a very well-balanced diet. So that kind of dietary habit in Japan may have a lot to do with this factor. Next, for a short period of time, I would like to cover the history of maternal and child health policies in Japan. What's shown on the left is the maternal mortality ratio and the infant mortality rates since World War II. As you can see, after World War II, the mortality rates have been lowered quite rapidly. In order to improve this, even from before World War II, there are various initiatives taken. The characteristics are summarized as 3 points shown on the right. First, the maternal and child care health systems were established based on law. So the Maternal and Child Protection Law was enacted in 1937. Secondly, around health centers, they would offer services based on local areas. So the local communities were considered important. And then the registered dietitians and specialists were assigned across the country. On top of that, what's shown on the left, the children, including female children, and the ratio of those that are going to elementary school has been rising from the major restoration area. Those that are enrolled in the primary school, elementary school, is almost 100%. And graph on the right, place of delivery is after World War II. So from around the time of the end of World War II, almost 100% had home-based delivery, but now the figure is reversed. So properly trained professionals like midwives helped with the delivery of childbirth, so that has helped in reducing the mortality rates. So those are major factors behind reducing the mortality rates. So these initiatives have been taken to reduce or to improve the results, but situation is changing. Currently, in 1994, what's called Angel Plan was formulated to create environment that is conducive of child rearing. So as you can see, there is a declining birth rate, later marriage, women's advancement in the workplace, and isolated feeling during childbearing period. These challenges have surfaced as new issues. On the other hand, in year 2000, Healthy Parents and Children 21 was formulated. And child rearing and health support have been promoted by collaborating among the relevant organizations. In recent times, the issues are more complicated regarding these children and families. There will be more reports, but there's an increasing percentage of low birth weight infants, and there are issues around dietary habits. There is poverty among children and poor dietary habits, and then there is mental health issue for pregnant women. So these are issues that need to be addressed across sectors like education and welfare. So comprehensive initiatives are very much in need these days. Lastly, based on my experience of working in low-income, mid-income countries, what I considered important, the continuation of care, I'd like to talk about that. According to Maternal and Child Health Act in Japan, one woman would experience a whole series of child rearing, and there are various measures that are based on a law that provide support. What is in the middle of this diagram, the Mother and Child Handbook can be quite central and effective tool to ensure the continued care for maternal and child care. I'm sure Professor Mizumoto will touch upon this handbook. So that is all from me. Thank you very much. Thank you, Professor Iwamoto, for going over the policy of maternal and child care in Japan.
Next presentation will be more focusing on the aspect of nutrition, and then the speaker is Professor Kaori Mizumoto of Nakamura School University. Thank you very much. My name is Mizumoto. Thank you for the introduction. From myself, I would like to discuss the characteristics of Japan's maternal and child nutrition policies. Similar to many other countries and areas in the world, in Japan, all the mothers and the children are eligible for health services from pregnancy to the birth, as well as to the start of the school education of the children. These services cover the whole period. And then after the start of the elementary school education, there will be other set of services. And one of the characteristics of Japan's maternal and child nutrition policies is that regardless of where in Japan, the consistent support is provided nationwide to mother and child. And based on the national guidelines, and professionals such as the registered dietitians and other professions are collaborating to promote a healthy diet for mothers and children. That's the second characteristic, nutritional support from pregnancy to early childhood. And the third characteristic is that formulation and improvement of process of adapting to the changing circumstances of mothers and children based on the scientific evidences and with the repetitive implementation of a PDCA, so that the society can be healthy and nutritious for all the mothers and children. And then in terms of the consistent support, which can be available in all the nation of Japan, There are collective support through schools and individual support through household visits, and also other types of the support. And those are similar to the support provided in other countries. But in Japan, they are based on laws and then they are free of charge in all the municipalities in Japan. So wherever you are born, a certain level of quality of the health services are guaranteed for any child, older child, and then even at the time of moving, by changing the municipalities, and there is still continuous and consistent support provided. And by pregnancy being registered at the public health offices in municipalities, and there is an issuance of the Mother and Child Health Handbook, and then by referring to that handbook, and the professionals and the healthcare services providers and can provide consistent support. And then that maternal and child health handbook is not merely only a recording purpose, but then it's a very useful tool which can provide various types of information for nutrition and then health of mothers and the child. And then compared to the internet and other media, that this maternal and child health handbook is very useful information provider and the information media with a high level of reliability. About 14 legally binding and health checkups during the pregnancy, as well as the 2 health checkups right after the childbirth, provided free of charge. And then also the breastfeeding status and the weaning status, record can be kept in the relevant pages of this maternal and child health handbooks by professionals and also by mothers entering themselves information, so that the comprehensive record keeping can be available for the child development and growth. And during the health checkups in the field, this handbook is also being used as a tool. And along with the contents of this handbook, there are mothers with a lot of details and keep a record of child development process. And when children become adult, they can read this handbook and they can feel once again the love of their mothers. I heard many episodes of that type as well. On this slide, at the extreme right, you can see the chart, which I actually used in real municipality. And with these charts, you can plot the body weights of the mothers. And there are 3 different kinds of charts depending on the pre-pregnancy BMI. And then Professor Morisaki will be discussing with further details regarding the weight changes during the pregnancy. But with this type of data and the charts, it becomes possible to provide an accurate information about the health and the nutrition. And then, as you can see on the left-hand side in the charts, and you can see the correlation between the BMIs and then complication risks. And before becoming a school teacher for 10 years in Pacific countries and African countries, I was involved in a certain number of research projects. In some countries, and record keeping of the body weights was kept accurately, but BMI calculation was not available because of the lack of the information about the pre-pregnancy body weight and then body weight of the mothers and right after the delivery. And then this type of charts can have an advantage of being able to be useful to provide an accurate support and reliable support and the nutritional guidance over the pregnancy, antenatal and postnatal periods. And then this is about the guideline and the guidance which are serving as a basis of this type of nutritional support. Guidelines and guidances can become an evidences, and this can be useful basis. And these become truly useful when they are used in a broad manner. And for the mothers and to be able to appropriately provide nutrition to their children, it is essential to have relevant professionals who can support those mothers. So there's, for instance, registered dietitians and nutritionists, and through collaboration of those professionals and networks, being built and established by municipalities so that the community-based services and the support can be provided. And then not only at the normal time, even when a natural disaster such as earthquake and typhoon happens, those support and services can be provided. And Professor SUDO will discuss that particular aspect in greater details later on in this session. So there is really a careful support constantly provided to mothers and children. And nutritional support for pregnant women starts not at the start of the pregnancy, but before that. And then Professor Morisaki will discuss in details and about the birth weight and then during the pregnancy weight body increase. But then you see that this Japanese food guides has these illustrations to support appropriately pregnant women in terms of the health appropriate diet and with a lot of specific advices. And this is not a nutritional nutrition-focused approach. This is a diet and meal-focused approach, which is much more specific and can be easily understood. After the delivery, breastfeeding and then also the artificial milk feeding in terms of how to feed babies, there are guidelines available as well. In these guidelines, lactating and weaning related basic information knowledge, they are from the registered dietitians and professionals, and they have been scrutinized and elaborated by those professionals so that an appropriate lactating and weaning by mothers can be promoted in terms of actual practices. So there is a true support structure, and also professionals are being trained for that purpose as well. And then our society is changing every single day. So the guidelines and then the guidances, and once they are defined, they cannot be permanently usable. They need to be changed and adapted and being based on evidences and with relevant revision and then amendment and improvement. So this continuous PDCA cycle is running is very important in our view. Also, knowledge available from Japanese maternal and child health and nutritional support and services can be available to the goal of developing countries' assistance. And in maternal and child health handbooks and introduction, and also promotion of healthy diets to tackle the lifestyle disease risks, and also creating systems for maternal and child health services. And those various activities and related knowledges are being provided to other countries, including developing countries from Japan. I would like to share some of my experiences at the end of this presentation. In the countries that I visited, there was so much learning for myself. This is East Timor, 10 years after the independence of the country. Hospital staff members and local NGO staffs and the village service workers are collaborating to conduct children's nutrition monitoring. I was so impressed by the collaboration, and then also there is a strong participation of fathers. So this field was really active. And then malnutrition of the children was more prominent after the weaning. And then that was reflected in the report that I shared with them. And then they were so delighted to have that report, and they said that they wanted to share the outcome and the findings from that report. I was so happy hearing that. And 1 or 2 years later, after that, I also heard the subsequent outcomes and reflected in the local activities in this village of East Timor. I was so happy knowing about that. So my happiness, both for being useful as well as for my own learning, still vividly remaining in my memories. So not only assisting in one way, but mutual learning is possible. Mutual learning across and sharing across all the nations is my personal wish, and so that we can support and cooperate with matters of all the nations throughout the world. Thank you very much. Thank you very much, Professor Mizumoto.
So that was on system guidelines and initiatives on maternal and child care. That was very much clearly explained. Those of you that are hearing this topic for the first time, you probably have a good idea of initiatives taken so far in the country and the overview of such policies. Now, let me move on to specific topics. First, on the topic of low birth weight and gestational weight gain, from National Center for Child Health and Department of Japan, I'd like to call upon Professor Naho Morisaki, if you could please. Thank you very much. I'd like to talk about first 1,000 days, the importance of that, and low birth weight and gestational weight gain. I'd like to cover these topics. First, the first 10 months in the womb and first 2 years of life are considered very important. That is widely known. About 25 years ago, the epidemiological studies gave a lot of, or have evolved into realm of science. Depending on the environment in the early life, our body goes through a permanent programming that shapes how our body is structured and functions, and it cannot be modified later on. Numerous studies in many fields have shown that early life can influence well-being and longevity. The most repeatedly found fact is in metabolism characteristics expressed in epigenetics, showing that undernutrition in early life can lead to obesity and non-communicative diseases risk. Also, recent research shows the psychological stress response mechanism called the HPA axis, responsible for building resilience and social performance, which is important for economic productivity and mental well-being, is formed also in early life. More recently, we have found that the microbiomes that reside in our bodies can influence our moods and metabolism from within. Now, the importance of childhood environment is recognized, but if you look at the birth rate and the trends, there are some concerning trends. The height of Japanese people have been consistently growing, but if you look at those that are born after 1980, it is detected that it is actually faltering. It is also found out that this is very much related to the low birth rate. This is not just about height, but it can also affect the adult health at the population wide. If the low birth weight births are high, then it can lead to diabetes and other diseases. So if we can reduce the low birth weight rates to what it was 20 years ago, we can improve the 3,000 more deaths per year. So what can be effective? One thing we have looked into is the guidance that is given. So in order to prevent the pregnant women's syndrome, the Japan Society of Obstetrics and Gynecology came up with the guidelines, but it became increasingly clear that this recommendation was not that effective in preventing the problem that they're trying to solve. So this was retracted. And it also increases the risk, but if it is too low, then it can lead to cesarean delivery. So there are advantages and disadvantages in gestational weight gain. That became clear in epidemiological studies. In that context, based on epidemiological analysis of a database of over 40,000 births from last 3 years, they've calculated the value, and they have set the recommendation as between plus and minus 1 kilogram of this value. So the guidelines based on evidence was issued in March this year from the Japan Gynecology and Obstetrician Association. Also, there was a guideline, it was reflected in the guideline issued by Ministry of Health, Labor and Welfare. So with the revision in this guideline, the lower limit was shifted by 3 kilograms. Also, it was in the case of those whose BMI is 30 or above, there were no specific guidance, but now they have come up with more guidance. Implementation of these guidelines started in March, so we are not sure how they will influence pregnancy outcomes, but we hope that our situation of low birth weight will turn for the better. On the other hand, without the tool, the day-to-day management of the weight cannot be implemented, as these revisions were quite significant. So there was a concern on how to implement this. So utilizing the Eco-Children survey, how much the gestational weight gain can be implemented, they created a chart, and that was published in October. There are 4 types, depending on the type of BMI, and this is for those that are underweight. And if the weight is within the yellow band, then that means by the time of delivery, your weight will fall under recommended range. It's been only 3 months since this was published, but this is incorporated by certain hospitals already. We hope that this will be instrumental in helping the pregnant women. So just in summary, I wanted to raise the issue of low birth weight, low birth weight issue. The period outside of the fetus is very important. So how to incorporate nutrition, the expertise should be reflected and should be made useful for citizens at large as well. Thank you for your attention. Thank you, Professor Morisaki. So with the revised guidelines, there was a presentation given. Next.
Next, regarding nutritional and dietary support for infants, mainly regarding initiatives taken in daycare centers, will be presented about by Professor Nobuko Murayama of University of Niigata Prefecture. She is logging in through online. Thank you very much. Thank you for the introduction. I'd like I am Murayama from University of Niigata Prefecture. I'd like to discuss the topic of nutritional and dietary support for infants and then talk about the initiatives taken in daycare centers and nursery schools. There are various types and formats of daycare centers and nursery schools, but I would like to generically use the term of daycare centers in my presentation. The right-hand side chart shows the utilization rate of daycare centers in Japan, along with the percentage of women working. And the employment rate of women between age of 25 and 44 years old is blue line. Along with the increase of that, the proportion of women employment rate, and as you can see, particularly in red line, utilization rate of daycare centers, and particularly for the infants of 1 and 2 years old, has been increasing. And in 2020, it was almost 50% of women being it was almost 50% of the infants utilizing a daycare center. And then 2.37 million is the number in 2021. Next slide. This is about the nutritional status of the infants and going to daycare centers. And then on the left, you can see about 780 daycare centers. We conducted a survey in 2020 in the whole of Japan. And then you can see 2.3% of the children were skinny and 4.4% of the children were obese. And then on the right, you can see the average in stunning wasting and overweight, and comparing Japan and the rest of the world. This is available from UNICEF. As you can see that stunning wasting obesity percentage are lower in Japan compared to the rest of the world. And as you can see that the nutrition issues are lesser in Japan, internationally speaking, but depending on the economic status of the households and the disparate situations amongst the nutrition status of the children, this is a result of about the frequency of the intake of different types of food. And you can see that depending on the economic status of the households, there are differences. And fish and fruits and vegetables are more taken by children having an economic advantage, but instant noodles are taken more by children of the households and families relatively economically disadvantaged. In this situation, in daycare centers, to all the children going to the daycare centers, nutrition and health support are provided. So that in the daycare center, the diet education and health support are based on the National Curriculum Standards for Daycare Center, which was revised and for the latest version in 2018. Daycare national curriculum standards are national standards for all the daycare centers and across the country. So by practicing being based on these standards, there can be a consistency of a support provided throughout the nation by all the daycare centers. And so this is a platform guideline. And then regarding the promotion of dietary education, I'd like to share with you the contents of these national standards. And first, dietary education provided in the daycare centers needs to make use of the characteristics of the daycare centers. That's the standard. That means that in order to develop the ability to manage the diet, the foundational capabilities need to be provided to children. And the children should learn enjoying eating and enjoying meals through the experience of food and diet, and also dietary education plans, including the provision of meals, need to be covered. And the second point of this standard about the dietary education is that the improvement of dietary education environment needs to be developed. So the relationship between children and the cookers should be considered, and also collaboration with the parents and various local stakeholders, collaboration with the healthcare providers is also required so that a response can be appropriately given to mental and physical conditions of each child, such as child with poor physical condition, food allergies, or disability. Through this dietary education, in each of the daycare center, dietary education plans is created so that daily eating experiences as well as growing vegetables and in the gardens, those experiences are being practiced. Next, please. In this national standards regarding the health support for children, it is said that the accurate capturing needs to be done about the health and body status regarding the height and body weight of the children and the development status. This is these are the data that we conducted about in the nationwide and about the daycare centers and about the nutritional management and assessment frequency. Many daycare centers conduct an assessment of health status of children on a monthly basis. And as an outcome of an assessment, and dietary education and adjusting amount of servings of the meals at the daycare centers were often observed. And next, regarding food allergy handling, from the same survey, in almost all of the daycare center, we found that there were some actions and measures taken to cope with the food allergies. And the majority of the daycare centers taken all allergen food and take care of all the children having food allergies. This type of dietary education and health support, it requires a professional resources and then part of them are registered dietitians. In the left-hand chart, you can see increase in the ratio of registered dietitians and dietitians in daycare centers. In daycare centers, registered dietitians and the ratio of placement of them. As you can see in the green line chart, and it is over 60%, and as of today, after increasing constantly. A part of the background of this is a premium for nutrition, which can be paid when the registered dietitians are hired. And on the right, you can see the chart regarding the PDCA assessment and then the percentage of an assessment planning and then improvement being implemented. Public school on the left-hand side and private school on the right-hand side. And then registered dietitians are blue bar, and then orange bar shows the dietitians compared to the gray bars, and which means lack of those professionals. You can see that there are more daycare centers having those professionals, and particularly public schools have over 90% of public schools have professional registered dietitians, and then further promotion and development of this is expected to happen. To summarize, the prevalence of obesity and skinny children among and 5 years old in Japan is low in the world. And first of all, also in Japan, the number and utilization rate of children who use daycare centers is increasing as the employment rate of women increases. On the other hand, then we can see economic differences in terms of the contents of the food and the detail of the food actually taken. That means that nutrition and health support provided at a daycare center becomes even more important. And then in the national standards and guidelines for daycare center, national curriculum standards for daycare center, there are standards defined for the nutritional support and health support for children, so that the personal and individual support as well as a safe and secure food provision practiced. What is expected going forward is to improve further the quality of this nutritional and health support. Thank you very much. Thank you very much, Professor Murayama. So during the infancy and young childhood, it is essential to provide an appropriate nutritional and health support, and daycare centers are one of the very important societal resources which can provide that. Thank you very much.
Next is the last presenter on the topic of rendering support for those that were victims of disasters. Professor Noriko SUDO of Ochanomizu University will give a presentation. Thank you for your introduction. Japan is a country with lots of natural disasters. What struck on March 11, 2011, the Great East Japan earthquake, was reported widely across the world, across the globe. To maintain the health of the evacuees, it is important to provide meals with consideration for nutrition at evacuation shelters. As such, the Ministry of Health, Labor and Welfare issued nutritional reference values for evacuation shelters when the Great East Japan earthquake struck to affected local governments. These values are weighed by the population composition of the municipal government in question, based on intake of nutrition for Japanese. These are not to be used to manage individuals' nutritional care. These are to be used as reference in providing nutritionally appropriate meals at evacuation shelters. These are comprehensive values for persons aged 1 year and above. Values by age groups are also shown so that the needs of the vulnerable people at evacuation shelters, such as infants and the elderly, can be addressed. The values are shown in such a way that the detailed considerations can be given to people in all life stages, even in times of disasters. During the first few days until the food aid gets to the disaster-stricken area, food stocks of the local government will be provided at evacuation shelters. What's written in blue is a tool that was created to help with the food stock plans as to what kind of food items in what quantities should be stocked in terms of nutritional reference values. As for what is written in red, that's a simple simulator for calculating nutritional food stocks in preparation for large-scale disasters. Let me go over how to use this. This is an Excel spreadsheet, and anyone can download this from the Ministry of Health, Labor and Welfare website. First, you choose the name of the prefecture from the pull-down menu, and then you choose the name of the city, town, and village in that prefecture from the pull-down menu. In this example, Bunkyo City is taken as an example, and the population of that city as of January 1st, 2019, which is the latest population data at the time of creating the simulator, will be shown. Next, the percentage of estimated victims is manually entered, and that should display, that lead to the display of the number of estimated victims. And then lastly, you enter the number of days to be covered. In the case of Bunkyo City, it's 1 day of stockpile of food. Next, within the population of Bunkyo City and of the estimated victims, it also displays the number of vulnerable people that will be included in the evacuees. For instance, for the whole of Bunkyo City, there are 1,587 infants, and among the estimated victims, it is assumed that 301 infants will be included. Apart from that, there are people with difficulty in chewing and swallowing, patients with food allergy, pregnant women, women with menstruation, hypertension, diabetic, kidney disease patients. Numbers are also shown. For instance, those with food allergies, 0-year-old accounts for biggest portion at 30% of the total, and up to the age of 30, that would be 65%. And the consideration, messages for consideration shows that be careful for foods in red. What is meant by that is explained on the next slide. This is the screen to choose the food items to be stocked at local governments. You choose a food item from pull-down menu by different food groups, even in a time of disaster, since it is aimed at the meals with staple foods and main and side dishes to be offered. You are to choose from different items. So what is shown in red here is canned grilled chicken, which is stocked as the main dish. This is because chicken is included as 21 items whose labeling is recommended, and among 7 items which is mandatory to put the labeling in terms of allergen. So such food items are shown in red, so that would require additional care in distribution. This is the result of the calculation. Orange number is the nutrition reference values weighed by the gender and age group composition of the municipality in question, multiplied by the number of days covered and the number of victims. So this is the total required amount of nutrition for the entire population of evacuees. What's shown on green, or what's shown in green, is the total amount supplied in terms of nutrients supplied by the municipality in question's food stockpile. What's on the furthest right is the total supply divided by total required amount times 100. And yellow is the evaluation. If it is above 100%, circle is indicated. If it's below 100%, X is indicated. So by referencing these results, you can review the food stock. You are to prepare before the disaster strikes, but what will happen once a disaster strikes? The Ministry of Health, Welfare and Labor works closely with the related organizations such as Japan Dietetic Association and Prefectural Dietetic Association to provide support to local governments that run the evacuation center in order to protect the infants and mothers in the evacuation shelter. Japan Dietetic Association creates a nutrition handbook as shown on this slide. This is to be referenced in case there are infants at evacuation center, even for personnel that are not necessarily knowledgeable about these areas. First, it is important that the mothers that are nursing would eat properly. So using the balanced diet guidebook, there is advice for the meals to be taken by mothers. Also, it is important that the mother's milk be provided at the time of disasters. So there are descriptions of the benefits of breastfeeding. Oftentimes in Japan, the evacuation centers are open space like a gymnasium. So there are special spaces set up so that mothers can nurse without having to worry about being seen by others. Even so, in some cases, the babies may continue to cry, and if the mother hesitates to go to general evacuation center, there are special mother and child centers or evacuation centers set up. In Bunkyo City, with the cooperation of Japan Dietetic Association, universities, child care centers, and private sector companies, private baby consortium has been formed. So with the agreements with 4 universities in Bunkyo City, they would accept pregnant and lactating women and their children. 4 universities would provide training to open and run a special shelter, special needs shelter. And they also have specific food items that can be used as baby food, such as porridge, rice with chestnut, beef curry, miso soup, and canned grilled chicken. As shown, as presented, the Ministry of Health, Labor and Welfare, by working together with related governments and local governments, they have come up with nutrition policies that leave no one behind, even in the times of disasters. They aim to provide meals with staple food, main dishes, and side dishes. In addition to all the life stages, the nutrition policy is such that the injured and the disaster-stricken evacuees can be covered. That is all. Thank you very much, Professor SUDO. In this country, in recent years, there have been large-scale natural disasters. Every time, various measures are taken and research projects would be underway. And as Professor SUDO just presented, there are preparations made for disasters. So step by step, such systems are being set up. So regarding these efforts, maybe these can be useful for other countries as well. So far, 5 presenters gave presentations. We'd like to use the rest of the time for the discussion among the presenters. As one of the 5 themes of Nutrition Summit in Tokyo, integration of nutrition to universal health coverage is set forth. The presenters I'd like the presenters to talk about your own experience of supporting the maternal and child healthcare in countries outside of Japan. So in that context, if you have any observations in terms of the characteristics of Japan initiatives in Japan, if you could touch upon that, that would be appreciated. I'll start with you, Professor Iwamoto.
SDGs の視点から2点。
So from my perspective, I'd like to talk about 2 points from SDGs. In the global maternal and child care, MDGs from the global or from the MDG perspective, it is said that they have made some success, even from the days of MDGs. And now it's been shifted to SDGs. And so far there was a focus on surviving. But under the age of SDGs, you thrive and transform. So to be born better and to grow up better, we are aiming to have such an era. In that context, I visited low and medium income countries and I experienced some work related to nutrition and maternal and child care. And what I felt strongly is the initiatives to grow better would be much more needed going forward. In Japan, or what is established in Japan, the public health checkup and the follow-up would be one initiative. Babies that are born well, recently prenatal checkup. Immediately after being born, the measurements would be done in low, medium income countries at the hospitals that the babies are born. So they are measured and they have some kind of record-keeping system which is similar to the maternal and child handbook in Japan. But what is still lacking is how to utilize the results of the measurements. I think there is still room for improvement in utilizing the results of measurement. And also to look at the development, not just how they grow, is quite challenging. So skills are needed and how to lead that to practice is very much needed. And the children that need care, how to start, where to start caring for them and when to start, that kind of systematic effort will be needed in many countries based on my own impression. So the follow-up in terms of prenatal or at different stages of child is not enough. Hopefully we can come up with a system to ensure the quality of such checkups. Second point is the vulnerable population and the care for those population. That will become increasingly important. Professor SUDO talked about the efforts under disaster. Currently, there are many disasters taking place in different parts of the world. And also there are refugees, those that are forced to migrate across the borders. We are seeing an increase in such a number of people. So those that are falling behind or they need to leave behind the system of care that they used to receive. Japan is no exception. Those that are left behind in the context of poverty or a conflict, those that are unable to raise their voices, in what ways we should make sure that they are alive, thrive, and transform, how we can provide the assistance so that they can do so is one major issue. The key word of the differences or divisions, disparity was mentioned. So in various activities, we need to ensure that there will be no widening of disparity of incomes or economic status. So anyone should be able to receive the services that are needed regardless of where they are and who they are. That is needed. That is all from me. Thank you, Professor Iwamoto. How about you, Professor Mizumoto?
はい。
Yes. Well, from myself, mothers and expecting mothers, whether or not they have an access to basic health care is very important. And I was surprised in low to mid-income countries. During the pregnancy, the initial health checkup was done only after the 20th week of the pregnancy in those some of those countries. It starts much earlier in Japan, in earlier phase of pregnancy in Japan, which we feel is normal, but it is not practiced in those countries. And I had never realized why it was normal for us and why we recognize that as such. And then I also try to think how it can be brought and to earlier in those mid to low income countries. I think it is a global thinking which needs to happen to tackle that challenge. And also the breastfeeding being continued for 2 years after following the start of breastfeeding, that is globally recommended. And in developing countries, many women are doing agricultural work, and then the fields are away from the houses. So even if they wish to continue breastfeeding, it is not always possible. In Japan, home electric appliances are present in every household. There is refrigerators, and then even if mother is not all the time at home, someone else can take care of the babies or bring the frozen milk to daycare center. So that needs to be addressed by the society and the community so that the breastfeeding can continue. I think that's also a challenge which should be addressed globally, learning also from our experiences in Japan. Lastly, as I slightly touched upon in my presentation as well, registered dietitians in Japan, they recommending taking a lot of vitamin C or recommending taking a lot of proteins. That's a nutrition-focused approach rather than that type of nutrition-focused approach. And I think it is important for the registered dietitians to focus on meals, recommending types of meals to be taken. Thank you very much. Professor SUDO, please.
So the integration of nutrition into universal health coverage, what that means when I think about that, anyone, when needed, in places that is close to them, being able to access nutrition, that is necessary. First, in Japan, the registered dietitian was introduced, and the number of registered dietitian and dietitian, the number of those is one of the highest in Japan, in the world, and they are stationed around the country, and nutrition guidance and health promotion are being conducted. So the residents can receive such services from qualified health professionals. So this kind of local health system is quite solid. So that's one strength in Japan. On the other hand, the among the developing countries, there may be cases where the evacuation shelters are not even opened. Even if such shelters are opened, the support is very much relied upon the outside organizations. So when disaster strikes, that can lead to economic and physical difficulties, but everyone should be able to receive the appropriate nutrition. So that has to do with goal 3, health and well-being, welfare. From that perspective, it's very important. In Japan, there's the long history of surveying the nutrition-related status and utilizing that. At the time of a disaster, the appropriate meals are provided. Even under the disaster, PDCA cycle is implemented to provide the nutritionally appropriate meals. But in countries where they find it difficult to take such measures, and it will be quite difficult during the disasters. In some developing countries, they don't have the mechanisms to monitor what happens to infants and other vulnerable people. So the strength of Japan is that they're able to utilize the systems in place that have been running without disaster. But rather than just public support, there is disaster prevention education being implemented as part of the local administration. But at households that have difficulty providing for food from day to day, they won't have stockpile for preparation of disaster. So that's one challenge. So when it comes to universal health coverage, the image you would have is the coverage of universal healthcare or a health insurance system. Japan's universal healthcare is something that is drawing a lot of attention, but among the group of presenters here, as you conduct review from various perspectives, what serves as the basis of medical services, the dietary related initiatives have been quite important, not just the mother and child nutrition, LCT, or taking measures to prevent the health and nutrition that has had good results. And in recent times, with the declining birth rate and the aging society, all kinds of nutrition care addressing elderly is becoming quite important. And in terms of leaving no one behind, it has had good and significant outcomes. So in that sense, in terms of the connection with the social background, I will have Professor Murayama talk about that. But in the context of universal health coverage and the roles and importance of nutrition and how that is projected against the backgrounds of various countries from a broad and perspective and in-depth, hopefully we can have more thoughts on that. I'll move on to the next topic.
人生最初
The very first 1,000 days, the importance of that period was discussed by Professor Morisaki. So building a health even before pregnancy, from that viewpoint, and do you have any useful advices to give to us for the future, please?
Thank you. As for building for health before pregnancy, there are 3 key points. First is to have proper body, and second is to have proper habits, and then health literacy and the ability to select proper knowledge. So first, in terms of building strong body, I talked about the gains in weight, but even if you're skinny, or if you're skinny, then there's a higher risk of a low birth weight. Also, you're unlikely to be pregnant. This holds true for obese people. And also being skinny can lead to anemia, and it is difficult to improve before pregnancy. So for men and women, you need to make sure that you build strong bodies. And when it comes to building good habits during your pregnancy, it is quite difficult to change your eating habits. For instance, if you're eating fish, vegetables, and if you're careful about a well-balanced diet, even if you become pregnant and have morning sickness, your diet is still well-balanced. On the other hand, those people that do not have well-balanced diet, their diet remains imbalanced even after being pregnant. So even before pregnancy, it is quite important to have a well-balanced diet. The third point, health literacy regarding pregnancy and sex and nutrition and cooking, all of these are very important. How you get pregnant needs to be understood. That way, unexpected pregnancy or unexpected inability to get pregnant can be understood more. And from early on, from junior high school age, the importance of nutrition in relation to pregnancy should be taught. So these are the 3 points that we should expect that more to be done in Japan. Thank you. In Japan, in recent years, the concept of health literacy is drawing quite a lot of attention. So this is a very important concept, but in adolescence or those in adolescence, the health literacy and is not necessarily done. So those generations who are using SNS on a daily basis, some kind of consideration needs to be given. So Professor Mizumoto, any thoughts on that?
Thank you for the question. Well, building a health even before pregnancy, when it comes to that topic, and I cannot help myself thinking about my students that I am in contact with every day. And when we take statistical data amongst the students, a majority of them use an SNS as the primary information source. So there is an overwhelming volume and the quantity of information, and in order to identify the accurate and appropriate information, I think essentially we need to have a good health literacy. But young students, according to the result of this year's survey, they do not use really the SNS primarily about food and nutrition and health information. They have information learning from friends and people, adults surrounding them, such as the parents, and also they do their own search on the internet. So capability and skill to collect accurate information even from an SNS as a source, and also the skill and the capabilities to think for themselves what should be right for their health. I think building those capabilities and skill is very important for young people. And young people want to be slender and thinner. Even if they have the appropriate body weight, they still would like to reduce their body weight. And then celebrities and popular actresses and celebrities and the image they would like to emulate. And then we conducted a diet survey this year, and surprisingly, the rate of taking breakfast increased slightly compared to previous results. However, not having a supper and not eating rice for supper, many answered that way, and the reason why they don't eat at night or not rice for supper is because they would like to be thinner and then get reduced body weight. I think an education in that regard for youngsters is very important. Prior to this session, there was session focusing on the obesity of children and then global trends and of food and beverage marketing to children and then actions taken to counter that were also presented about. Well, digital marketing and space exists and as of today, SNS and the marketings are linked with each other and particularly toward the young and target. There is a significant impact from them on their behavior. So not only the dietary education wise, but also regarding the health building during the first 1,000 days and following the birth, I think there are a lot of thinking that we have to do regarding SNS and the infant botulinus syndrome. There are not many cases of that in Japan, but there was some tragedy deaths, and because some mothers trusted information available from SNS, and they fed their babies for 5 weeks with honey. And that was the reason for the baby's death. The maternal and child health handbook explicitly says that it is dangerous to feed babies and infants with honey, but the wrong information were circulating, unfortunately, on the SNS. And then this type of challenge and issues needs to be more in-depth thought about, we believe, in the maternal and child health and nutrition context. I'd like to move on to the last topic. Regarding the provision of meals, catering the growth of infants and the process of development, there is not only a challenge associated with the nutrition, but then we need to also consider societal aspects. I would like to hand over to Professor Murayama about that, please. Yes, thank you very much. Professor Iwamoto at the beginning said that we need to think about inequality in order not to leave anyone behind. In Japan as well, nutrition and the diet of children is affected by societal determinants, and survey results showed that. In some prior researches, it was showed that when the babies in economic disadvantages and situations, the body weight increase, and during the initial 5 months is poor. And also the diet, and there is a correlation between the diet habits and the household economic situation. And also from our research, during the state of agency, because due to the COVID-19 in Japan, we gained some understanding about the diet of the young children. In the households with a low income level, the diet of children show increase of only supplementary meals, and also sweets and then snacks only increased. In order to reduce that type of disparities and inequalities, there are some actions I'd like to share with you, some of our actions in the framework of our researches and projects. In the school meals, school lunch, we gained some evidence showing that school lunch can be useful to reduce the gap and inequalities. We believe that the daycare centers meals seemingly are playing a similar role, which is still under investigation. And then in recent surveys about the daycare centers, it was showed that the children from relatively poor families, there were some questions if the daycare center takes some special consideration for those children, and then the results show that most of the daycare centers do take a special consideration. Specifically, they provide support to parents, and also they take some individual care of those children during daycare center meals. And the malnutrition is also part of the current challenges. At the same time, daycare centers not institutionally or systematically well developed in some areas of the world, and I think that good examples of daycare centers in Japan can be some source of learnings going forward. Thank you very much. Thank you very much, Professor Murayama. Professor Morisaki also conducted some related surveys and researches, so please give some comments.
Thank you for that. So in December last year, what was done, the survey across the nation of elementary school children, I'd like to draw upon that survey. As Professor Murayama just talked about the importance of school meals, school lunches. We also found that school lunches can reduce the inequality or disparity even in the COVID-19 pandemic. Last year, in April, for the entire month, most of the elementary and junior high schools were closed. And during that time, in most households, regardless of the household income, the dietary balance became worse. The dietary balance means vegetables, meats, fish, eggs, the proteins being taken in. And there are many households that are having difficulty achieving that balance. But the percentage of households with imbalance in diet, well, in the case of school lunches that is being offered in most elementary and junior high schools in Japan, while the school lunches are being provided, there were significant gaps. But during the school shutdown, the low-income household had more households whose dietary balance was not well. And after the lifting of the school shutdown, there is lower gap. One other point is COVID-19 pandemic. There are differences of the impact depending on socioeconomic status. According to our survey, we asked parents about their situation in terms of economic situation. Among households that have economic income, some responses indicated that they have bigger room to be relaxed. On the other hand, among low-income households, they don't have time to relax and they don't have economic means either. There are a lot of uncertainties around the pandemic, how the pandemic would end, but initiatives need to be taken in perhaps under universal healthcare, and initiatives should be taken in relation to nutrition as well. Thank you very much. There was a mention of expansion of pandemic, and together with that, the dietary habits and other changes in life were introduced or were touched upon. So in this situation of new difficulties, there are some new challenges that became apparent. Against that backdrop, from the perspective of no one is left behind, we need to put our thoughts together to think of a better way. And also there are new learnings, and also with the advancement of technology, maybe we can move ahead. And in that context, maybe there will be more initiatives taken in the field of maternal and child care, including those that presented this time. The maternal and child nutrition initiatives were reviewed, and as we did so, perhaps we were able to confirm our own footings or where we have been positioned, and also what we have reviewed so far. I hear that the presentation materials used during this session will be made available on the website. Hopefully these will be of some use for people from different countries. In different life stages, the mother and the child these are very important stages, and that doesn't need to be repeated. But towards the future, and not just in specific countries, but for the globe as a whole, and this is extremely important. And those of us that are involved in this field should feel responsible for our own action, and we need to be even more creative regarding various aspects. We wanted to have discussions, but especially for those from developing countries, hopefully what we have discussed will be of some use. So what was referred to in some presentations, the introduction of maternal and child handbook, this is done across the nation. Almost all the mothers have this handbook, and almost everyone has gone through the checkup during their pregnancy and soon after a child is born. And registered dietitian will be involved in health instruction and guidance. And that way, various initiatives have been taken in terms of maternal and child nutrition. Regarding such initiatives, the maternal and child handbook was introduced, has been introduced in many countries, and there have been some good results, as was introduced today. There are new challenges, issues and challenges that have emerged. So perhaps a maternal and child handbook can be used as a common platform. Maybe digitalization of the handbook may be one challenge that we should take on going forward. Also, in order to promote healthy food, this time 1,000 days of nutrition, if you think about that, medically it is significant. That goes without saying. But what supports that? Through meals, and there have been some remarks made about how to provide support through meals. So it's not just about covering the shortage of minute nutrients that are needed. Of course, you can utilize nutritional supplements effectively, but the meals that you have on a daily basis, that should be recommended even from pregnancy and should be put into practice. In Japan, what is called shokuiku, or there are policies taken to provide dietary education, so you could utilize that, and that way sound diet can be promoted further. That goes without saying. It may be taken even though it may be taken for granted. And then in terms of leaving no one behind, what is symbolic is that in the time of a major disaster, there's no telling when such disaster will take place or where it will strike. The victims, in an instant, they may be left behind. So to prepare for such an instance from normalcy, that is quite an undertaking, but somehow we should be prepared for such an event as much as possible. So Ministry of Health, Labor and Welfare, and other government agencies have taken various initiatives, and local governments and related organizations like Dietitians Association have worked on this, and universities have formed a network, or to build a network involving various organizations, including universities, would be quite important. Japan is a privileged country in terms of economic and social standing. That's how Japan is viewed from other countries, perhaps, but resources are very much limited. With such limited resources, how to utilize them? In that context, when you think about it, what was presented today, the various initiatives for maternal and child nutrition, I think the priorities in that area are high, and we need to advocate for that And to do that, we need to do even more.
このような
So today, at this opportunity of this session, where the time was limited, but then we were able to share a lot of learnings. I hope that then this shared learning will be useful and helpful for your future activities. With this, we would like to close this session. Thank you very much once again for the 5 speakers, and thank you very much to all the participants. Thank you so much.